Welcome to Sante Lakay, a coffee talk podcast brought to you by Zanmi Lasante. I'm Corley Noisette, the Director of Development and your host. I'm thrilled to welcome you to this new series where we'll be joined by experts and leaders across Zanmi Lasante's departments and sites. In each episode, we'll be joined by those on the front line of healthcare in Haiti, sharing insights, challenges, and successes across a range of health topics impacting our communities. From managing health programs in rural areas to responding to public health crises, our leaders will give you a close-up look at the work happening every day to improve lives. So grab a cup of coffee, sit back, and join us for candid conversations about health, resilience, and hope, right here at Sante Lakay. Today with us, we have Dr. Reginald Fils-Aimé, who's the Director of Strategic Planning at Zanmi Lasante. Dr. Fils-Aimé oversees activities including research and strategic information at ZL. He is a Haitian physician who graduated from the State Medical School of Haiti and has a master's degree of medical sciences in global health delivery from Harvard Medical School. Over the past 16 years, he's worked with Zanmi Lasante, the Haitian sister organization of Partners in Health. In addition, he worked with Partners in Health Liberia, successfully serving patients in several clinical areas. Serving more than 10 years within Zanmi Lasante's mental health program, he has been one of the key leaders of the design and implementation of a successful comprehensive mental health program, which has become a national model of healthcare in Haiti. After leading PIH's mental health program in Liberia for almost 2 years, Dr. Fils-Aimé returned back to Zanmi Lasante to support governmental relations in Haiti before stepping into his role as director. Today, Dr. Fils-Aimé will share his unique perspective on what makes Zanmi Lasante successful in healthcare in Haiti and how the robust partnership with the Haitian Ministry of Health contributes to its impact. So thank you so much, Dr. Fils-Aimé, for joining us today. For those of our listeners who are not familiar with Zanmi Lasante or its historical presence in Haiti, can you please tell us a little bit about the founding story of Zanmi Lasante, how it began, and what was the vision?
Yes, thank you very much, Corally, and I thank everyone who are listening to this podcast, and thank you also for facilitating it and hosting it. Yes, I think Zanmi Lasante is an organization of almost 40 years of history in Haiti. The history started also with several people, with a diverse group of people. You had Père Lafontaine, an episcopal priest who was working in Mirabale and in the community of Kanj, a community where you had refugees from the Pelig hydroelectric dam who came to establish themselves in that community. So Père Lafontaine was working with this community and supported with his friends and supporters. You had Paul Farmer, Ophelia Dahl, Jim Kim, and other American friends. And you had also the communities. And still today, there are leaders in the Kanj community who have taken part in this history at the beginning. And I like listening to them, for example, talking about one of the first health surveillance project that was called Veiller Santé, that started in the 1980s, early 1980s, by the organization. So really it was from the start a partnership. And that partnership grew over the years. As you know, a sister organization will be founded in 1987 in the US by Paul Farmer and the same group of friends. In the 90s, the organization was really in Haiti in the middle of the fight against HIV, to have access to the HIV technology, HIV diagnostic technologies, and the medicine we had at that time. But later, in the middle of the 90s, really, we were one of the first organizations to provide HIV medication first to pregnant women. And when more effective HIV medication became available and poor people in Haiti, in Africa, elsewhere could not have it, then the organization again joined a fight, and it was a global advocacy movement to have access for people, everybody, especially people in uh, countries with low income, to have access to medication. And this is how really a key historical moment of the organization started in 1988 with an initiative called HIV Equity Initiative. And this initiative really, that was advocacy, but also that was finding practical ways and working with partners, even more partners, to provide access to medication to patient, but also working with community health workers to make sure we provide a complete, um, we provide really access to people who are living in remote areas. And that initiative was successful. There were several papers published in academic journal, and that initiative, I think, has informed many major global health initiative and funding initiative that will happen later. For example, the Global Fund and other, PEPFAR later in 2004-5, other initiatives. So really, that those are some key. And another key initiative I think that happened in the organization, um, in the 90s again, the organization was one of the first to be treating multi-drug resistant tuberculosis in Haiti. And this is a form of tuberculosis that is very difficult to treat. And the organization really, in rough times in the country, really attacked it, although the medication were expensive, but provided this medication to patients, uh, free, for free. Uh, so that multi-drug resistant tuberculosis initiative also impacted other, programs in Peru, for example, and lessons learned from this program really, um, informed changes of practices of protocol in the world, in WHO, and in now right now in the world. And Zanmi Lasante and Partners in Health are still, uh, at the front line of the fight against tuberculosis and HIV and many other, problems in the world. In the 2000s, then we'll start a period of expansion of Zanmi Lasante. It started in Kaj, but then there will be a period of expansion, and that period of expansion will be done with the Ministry of Health.
Thank you for sharing the history of Zanmi Lasante and Partners in Health. It just really demonstrates how, from the day one, they've been advocates for the most vulnerable, and continue to be, and have, shaped the history or the context of global health in the world. So, as I noted earlier, you've been with ZL for almost 2 decades, and so that you demonstrate a lot of profound understanding and commitment to the organization's mission. It would be really helpful if you could speak a little bit more about ZL's mission, and its foundational elements for healthcare delivery.
Yes, thank you. And I think this is one of the aspect I was thinking and talking about the history. Um, as you mentioned, I joined ZL because of this mission, particularly. And the mission of ZL, of Zanmi Lasante, is to provide a preferential option for the poor. This is almost a mantra, for all ZL, but also in other countries where, other site, yeah, Partners in Health sites. A preferential option for the poor in healthcare. And we can see that from the beginning. The choice that was made to work with a population that was displaced from a development project. And the choice also that's made to work with the rural areas and rural communities, which from data in Haiti, bear the biggest part of the poverty burden in Haiti. So that's what we mean. So it's an equity choice to work, to have a preferential option for the poor, by identifying who needs care the most and find the best ways to provide care to this population. So really, the way that's done is we talked about partnership, but we through partnership we try to bring we strive to bring the benefits of modern medical science to those most in need, and also we like to say to serve as an antidote to despair. And I think this word has resonated a lot in these last years in Zanmi Lasante, where we can see staying open, keeping our facility open, and continuing to provide quality care and with compassion and solidarity to the communities most in need really can create hope in uh, hopeless situations. So that is two key areas of the mission, and there are also I could say a couple of words about some of the way we do things. We talked about partnership, and we will talk more about partnership from the beginning, and we'll talk about the partnership with the Ministry of Health, but also and I think also the history of Zanmi Lasante showed that another value that's important to us is commitment and solidarity, and that both of these words really can be encapsulated in a word that is key in Zanmi Lasante, which is accompaniment. Uh, and accompaniment really means commit to work with someone or an entity to work together toward the vision of that person, and working together, facing the challenges together, and fighting also together the solution to this challenges. And that's what Zanmi Lasante has been doing with the communities, and also we have been doing with the public sector, and we have been doing that through tough times. I wanted to say that we have been doing that through tough times. 1980s, it was the start. It was during the Duvalier era. It was the start of the HIV pandemic. And 1990s, there was the coup. We were in Haiti during the 1991 coup, and after Zanmi Lasante stayed there. And we had 2004. Many Wilizia leaders will talk to you about some staff who were held at gunpoint in 2004. No one at that time for that particular episode was hurt, but there were really tough time. And right now we are also going through another tough time. So either for people within Zanmi Lasante, outside of Zanmi Lasante, it's a way also to say we've been through some tough time, and out of them we get with the Haitian people.
Thank you.
And that also speaks to the value of what is accompaniment, and how also Zanmi Lasante choose to work with the Haitian people.
Yeah. And just to add to that, we do have a network of over 2,000 community health workers, which also adds to that accompaniment that we provide patients.
Yes, that's really thank you. That's very important. And I mentioned the HIV equity initiative that started really with community health workers, and they were called accompagnateur, and also so that also linked to the value and the practice of accompaniment. And the community health workers, the accompagnateur, they are really the the best example of how accompaniment is done closely to, and by getting to know the person and accompanying them day to day in their challenges, but also at a different level we've been copying what the accompagnator have been done. That's one thing. And another also important value for us is solidarity, pragmatic solidarity. We don't only feel the solidarity in our heart, but also we act. We go to the ground and we act. And when we go to the ground, we make action. We take action, but we stay and we work toward the long-term vision of those we are serving until they don't need us anymore, until they don't want us anymore, but we are with them. That is also part of the accompaniment and solidarity. And we often make the distinction that our work is based on solidarity and not charity alone. And when we go to build, we think we need 5 S's: stuff. So we need staff. We need stuff, whether it is medicine, equipment, medical equipment, space. All of these are linked because the staff, they need the equipment to be effective, but they need also dignified and safe space to provide care for the patient. We need system. So there's a need for uh, not only clinical system, but also management system and governance system. And finally, very important for us is social support. And social support is one aspect really that um, if we are working with the most vulnerable, we need also to make sure we address the economic barriers to care, the social barriers to care, all of the other type of barriers to care. We need to address them, and that's so 5 S's that Zanmi Lasante uses to deliver a holistic care to those we are serving.
Thank you so much. Yeah, what I find is so unique about CL is our approach. Seeing it's very patient centered, a holistic approach to healthcare, addressing the underlying factors of poverty. So, yeah, it's just incredible the history and the mission and what drives everyone. Um, so I think what makes ZL different from other organizations is our commitment to health system strengthening and our robust partnership with the Ministry of Health for the past almost 40 years. Um, all our 17 sites across the Central Plateau and the Lower Artibonite departments, except for Conge, are public facilities. Um, and after the Ministry of Health, ZL is the largest healthcare provider in the country. And so I'm wondering if you could highlight some of the key areas of collaboration between Zanmi Lasante and the Ministry of Health on key health initiatives in Haiti. And why do you think they were so successful?
Yes. Yeah, thank you very much. I think this is key to Zanmi Lasante and the partnership with the public sector, with the Ministry of Health is key and central to the approach of Zanmi Lasante. And just a note that, health intervention in global health have been criticized also for um, the way they've been done in vertical ways, coming just with one program and not working with the Ministry of Health. That can really undermine the work of the public sector of the Ministry of Health. And Zanmi Lasante has learned and decided not to do that. So another aspect also is when people talk about strengthening health system, often they work with one aspect of strengthening health system. Maybe it's human resources, or maybe it's just systems, building a governance system or infrastructure, or one or two, but not most or all aspects of governance system. So Zanmi Lasante has decided if we want to have a sustainable impact while strengthening the national health system, we cannot work in a siloed system. We cannot work alone. We need to work with the Ministry of Health and the rest of the public sector. So that's why since the beginning, that's the choice Zanmi Lasante has made. Zanmi Lasante has been invited to work in more and more facilities in the Central Plateau and in the Artibonite. As you mentioned right now, a total of 17 health facilities. So so that is key and that is central. In so I think some project I can mention quickly. So as I said, Zanmi Lasante has been doing this. Maybe another aspect by working with the Ministry of Health. So it is really a work that we strive to do, and we do closely with the Ministry of Health, but also following the plan of the Ministry of Health. We just finished, for example, a strategic plan, and in the process of doing our strategic planning, the Ministry of Health strategic plan, which is the plan director, was one of the guiding document for us to make sure that we are aligned with the Ministry of Health plan. That's one. And but at another level also, in the process of making our strategic plan, we invited Ministry of Health officials at the regional level to work to tell us what their priorities are. So this is very important for us. And I also said we address civil aspect, and I mentioned earlier that we address, when we said we do 5 S's, that means we really work with the Ministry of Health on all of these aspects. We work to contribute to staff, increase the quantity of staff, but also to train staff. And one of our major right now initiative is the postgraduate medical education system. We are training specialists for this country that really critically need more well-trained healthcare specialists. So we have 13 specialization program with 7 medical specialty and fellowships in nursing specialty training programs. Really, so that is a key area where we are working with the public sector, and this is not done alone. This is done with the state university through the state medical school. Of course, the Ministry of Health is also supporting us in this endeavor. So that's one. And second, we talked, that's the human resources, but also of course there will be professional development and technical training and technical support to the staff. And second, stuff. So we, Zanmi Lasante, with the support of our partners, provide medication, provide equipment, whether it is diagnostic tools and machines for lab exams, for example, or for surgery. We provide this equipment and tools and supplies to all of the facilities where we work, and medicine, of course. And in terms of space, we make sure in all of the facilities where we are working that we have clean, dignified space. As you know, this is a constant work. So we constantly working with Ministry of Health, local leaders, regional leaders, and central to contribute to these efforts. So just to say that aspect, and I think that is part also of why Zanmi Lasante is trusted, but also successful, because of that respect we have for the public sector and willingness to work with the public sector. You mentioned also what are some key, I'll be brief on that, what are some key initiatives that we have done with the Ministry of Health. I just mentioned the training, the medical specialty training program, the Mirbala University Hospital that many many people know of, is really a key achievement, and it belongs to the Ministry of Health and administered by Zanmi Lasante. But this is a project that we have done with the public sector, with the state, and but now really that is a pillar in the Haitian health system, especially in the resilience of the Haitian health system, and we work in the kind of care we provide with the Ministry of Health in facilities of the Ministry of Health. You mentioned that all of the facilities we are working in belong to the Ministry of Health, except Kaj, who belongs to Zanmi Lasante. So we provide primary health care, meaning everyone can come in with any health problem they have, and we have a system that is accessible, appropriate, and affordable for everyone coming in. But we address also the burden, the highest burden of disease in the country. So we make sure we have strengthened program for people with HIV, people with tuberculosis, people with non-communicable disease, diabetes, and hypertension, and nutrition. So, and of course, whenever there's an emergency, Zanmi Lasante makes itself. We are there to respond alongside the Ministry of Health, alongside the public sector.
Yeah, I know Zanmi Lasante played a key role in the COVID-19 pandemic, cholera outbreak, earthquake response. So, I mean, I know we provide a lot of technical assistance to the Ministry of Health, and so it's very, very strong partnership we've had. Thank you for listening to the Sante Lakay podcast. Join us next week for another engaging conversation with an expert who is advancing public health in Haiti.